Did you know that over 11% of people aged 65 and older are living with Alzheimer's disease, the most common form of dementia? That's millions of individuals and families affected by this progressive brain disorder. Imagine suddenly struggling to remember simple things, like where you parked your car or how to get home from a familiar place. These seemingly minor lapses can be early warning signs of a much larger issue. Today, we're delving into the 12 early signs of Alzheimer's disease that everyone should be aware of. Understanding these signs and taking action early can make a significant difference. So, let's uncover these warning signs and learn how to protect your brain health for the future. Number 1. Loss of navigation. Have you ever found yourself disoriented in a familiar place or forgotten where you parked your car? This disconcerting experience could be more than just a momentary lapse. Loss of navigation is often one of the earliest signs of Alzheimer's disease. This symptom is linked to the shrinking of the parietal lobe, a part of the brain crucial for spatial memory and navigation. The parietal lobe helps us process spatial information and orient ourselves in our environment. When it begins to shrink due to Alzheimer's, this ability deteriorates. You might start to notice difficulty in remembering how you arrived at a location or in retracing your steps. Even familiar routes, like the way home from the grocery store or your usual path through a park, can become confusing. In the early stages, these navigation issues might seem minor or be easily attributed to stress or distraction. However, if they become more frequent and severe, it's important to pay attention. Losing your way in familiar settings or frequently forgetting where you parked can disrupt daily life and cause significant stress. While occasional forgetfulness can be normal, consistent problems with navigation should not be ignored. If you or someone you know experiences these symptoms, it's crucial to consult a healthcare professional for a thorough evaluation. Early detection and intervention can make a significant difference in managing Alzheimer's disease. 2. Judging distances. Struggling with depth perception or finding it difficult to judge distances accurately can be another early sign of Alzheimer's disease. This issue arises as some brain cells start to starve for glucose, affecting your ability to process visual and spatial information. For example, you might find it challenging to walk upstairs, park your car, or recognize 3D objects correctly. Tasks that require accurate judgment of distance, such as pouring a drink without spilling or reaching for an object, may become increasingly difficult. Vision problems associated with Alzheimer's can lead to frequent tripping, bumping into objects, or difficulty in navigating spaces that were once familiar. These difficulties are more pronounced than the typical vision changes associated with aging and can significantly impact daily activities. 3. Repeating yourself. Do you find yourself repeating the same stories or questions within a short period? This could be an early warning sign of Alzheimer's disease. Repeating yourself frequently occurs when the brain struggles to form new memories and connections. In Alzheimer's disease, the neurons in your brain have difficulty making new connections due to the buildup of amyloid plaques and other changes. This disruption means that recent conversations or events don't get stored properly in your memory. As a result, you might find yourself asking the same question multiple times or retelling a story you've already shared, without realizing you've done so. Family members and friends are often the first to notice this pattern. They might point out that you've already mentioned something or asked a question. While occasional repetition is normal, especially during stressful or busy times, consistent and frequent repetition is not. For instance, you might tell a friend about a recent trip, only to bring it up again a few minutes later as if you hadn't mentioned it before. This can be frustrating for both you and your loved ones, and it can indicate that your brain is having trouble processing and retaining new information. 4. Losing things. Misplacing items occasionally is normal, but consistently losing things and being unable to retrace your steps can be an early sign of Alzheimer's disease. This symptom is more than just common forgetfulness, it's an indication that the brain's ability to form and recall memories is deteriorating. When you have Alzheimer's, the connections between your neurons weaken and break down, making it difficult to remember where you placed everyday items. You might frequently lose keys, glasses, or important documents and struggle to remember where you last had them. Unlike typical forgetfulness, where you can usually backtrack and find the missing item, Alzheimer's makes it challenging to reconstruct your actions. For example, you might put your wallet in an unusual place, like the refrigerator, and have no recollection of doing so. Even more concerning, you might start accusing others of stealing your belongings because you genuinely cannot remember where you left them. This can lead to frustration and anxiety, both for you and those around you. 5. Memory aids. Using memory aids like sticky notes, reminders, or digital alerts is common and often helpful. However, an increasing reliance on these aids can be an early indicator of Alzheimer's disease. When your brain starts to struggle with forming new memories due to Alzheimer's, you may find yourself needing to use these tools more frequently to keep track of everyday tasks and important information. People in the early stages of Alzheimer's might cover their homes with sticky notes to remember simple tasks such as taking medication, locking the doors, or even turning off the stove. Digital reminders on phones or tablets might become essential for recalling appointments, birthdays, or other significant events. While these aids can be beneficial, a growing dependence on them could signal that your brain's natural memory functions are declining. For instance, you might find that without a sticky note, you forget to attend a scheduled meeting or buy essential groceries. You may start to create complex systems of reminders to manage daily life, and despite these efforts, still feel confused or overwhelmed. This reliance can be frustrating and worrisome, as it disrupts your normal routine and reduces your confidence in your memory. 6. Confusion. Experiencing frequent confusion about time, place, or people can be another early sign of Alzheimer's disease. This type of disorientation goes beyond occasional forgetfulness and can significantly impact daily life. As Alzheimer's progresses, it disrupts the brain's ability to process and store new information, leading to moments of bewilderment and uncertainty. Individuals with early Alzheimer's might confuse the time of day, often thinking it's morning when it's actually evening. They may forget where they are, how they got there, or why they are there in the first place. This confusion can be particularly pronounced in new or unfamiliar environments, but it can also occur in places they have known for years. For example, someone might leave the house thinking they are going to work, even though they retired years ago. This disorientation can also extend to people. Alzheimer's patients may not recognize familiar faces or might confuse people's identities. They could mistake a grandchild for their own child or believe they are in a different stage of life. This can lead to telling stories from the past as if they are happening in the present, further illustrating their disconnection from the current reality. 7. Speaking problems. Struggling to find the right words or having difficulty following a conversation can be an early sign of Alzheimer's disease. As Alzheimer's progresses, it can disrupt the brain's language centers, making it hard to communicate effectively. This goes beyond occasional lapses in conversation and can significantly affect day-to-day interactions. People with early Alzheimer's might frequently pause during conversations, searching for the right words to express themselves. They might describe an object or a concept indirectly because they can't recall its specific name, saying that thing you used to cook instead of stove, for example. This can make their speech seem disjointed and confusing to listeners. Following a conversation can also become challenging. Individuals might lose track of what was being said, ask repetitive questions, or respond inappropriately because they misunderstood a previous part of the discussion. This can be frustrating for both the speaker and the listener, leading to social withdrawal and communication barriers. Additionally, individuals with Alzheimer's might find it difficult to join in group discussions. They may have trouble keeping up with the flow of conversation or contributing relevant comments, causing them to feel isolated or embarrassed. 8. Problem solving. Experiencing difficulties with problem solving and planning everyday activities can be an early warning sign of Alzheimer's disease. This symptom goes beyond occasional errors and indicates a deeper disruption in cognitive functions that are essential for managing daily tasks. Individuals with early Alzheimer's might struggle to follow familiar procedures, such as following a recipe they've cooked for years. They might find it challenging to manage their finances, forgetting to pay bills or miscalculating expenses. These issues arise because Alzheimer's affects the brain's executive functions, which are crucial for organizing, planning, and carrying out complex tasks. For example, someone might forget the steps needed to prepare a meal, starting but not finishing cooking processes, or leaving out essential ingredients. They may also have trouble organizing their day, forgetting appointments or mixing up the order of tasks, like putting on clothes in an incorrect sequence. This decline in problem-solving skills can extend to more basic activities. They might find it hard to solve simple puzzles or navigate routine decisions, leading to frustration and a sense of helplessness. 9. New memory issues. One of the hallmark signs of early Alzheimer's disease is difficulty forming new memories. While everyone experiences occasional forgetfulness, Alzheimer's patients consistently struggle to remember recent events, conversations, or new information. This impairment goes beyond normal age-related memory lapses and indicates a deeper issue within the brain's ability to process and store new memories. For instance, someone with early Alzheimer's may have trouble remembering what they had for breakfast, even if it was just a few hours ago. They might repeat questions or stories because they don't recall that they've already asked or told them. This repetitive behavior is frustrating for both the individual and their loved ones. Additionally, new memory issues can manifest in forgetting appointments, important dates, or the names of new acquaintances. While they may still recall events from the distant past, their short-term memory becomes increasingly unreliable. This discrepancy occurs because Alzheimer's affects the brain's ability to create new connections, leading to a gradual decline in the retention of recent information. 10. Social withdrawal. Social withdrawal can be a significant early sign of Alzheimer's disease, impacting how individuals interact with others and participate in social activities. As Alzheimer's progresses, individuals may gradually withdraw from social engagements, hobbies, and interactions they once enjoyed. This withdrawal is often due to feelings of embarrassment, confusion, or discomfort stemming from cognitive decline. For example, someone with early Alzheimer's may start to avoid social gatherings or conversations because they struggle to follow the flow of discussion or remember names and faces. They may feel anxious or self-conscious about their memory lapses, leading them to isolate themselves to avoid embarrassment. This withdrawal can also stem from difficulty in maintaining meaningful conversations or engaging in activities they used to find enjoyable. Family members and friends may notice this change as the individual becomes less interested in socializing or participating in group activities. They may prefer solitude or familiar environments where they feel less vulnerable or overwhelmed by cognitive challenges. 11. Changes to personality. Alzheimer's disease can lead to noticeable changes in a person's personality, often affecting their mood, behavior, and emotional responses. These changes can be unsettling for both the individual and their loved ones, as they may differ significantly from the person's usual temperament and habits. As Alzheimer's progresses, individuals may become more irritable, anxious, or easily agitated, even in familiar situations. They may display heightened levels of suspicion or paranoia, believing that others are plotting against them or stealing from them. Conversely, some individuals may become apathetic or withdrawn, losing interest in activities they once enjoyed. Changes in personality can also manifest as increased impulsivity or disinhibition, leading to socially inappropriate behaviors. For example, someone who was previously reserved may now make tactless comments or exhibit inappropriate sexual behavior. These changes occur because Alzheimer's affects the brain's frontal lobe, which regulates emotions, impulses, and social behavior. 12. Misidentification. Misidentification is a troubling early sign of Alzheimer's disease where individuals begin to confuse people, places, or objects. This can lead to disorientation and emotional distress. For example, someone with Alzheimer's might mistake a close family member, like their son, for another person, such as their spouse. They may also misidentify everyday objects, believing a TV remote is a phone or a stranger in the mirror is an intruder. These misidentifications occur because Alzheimer's affects the brain regions responsible for recognition and memory. As the disease progresses, it becomes increasingly difficult for the brain to process and correctly interpret visual and contextual information. Misidentification can be particularly challenging for caregivers, who may find these episodes distressing or hard to manage. What can you do to protect your brain? If you're concerned about Alzheimer's, there are proactive steps you can take. 1. Avoid sugary and refined foods. Cut out sugary foods, refined carbs, and alcohol. Replace them with healthy fats like extra virgin olive oil, avocado, and raw coconut oil to prevent damage to blood vessels in the brain. 2. Exercise regularly. Engage in activities like jogging or swimming for at least 30 minutes, twice a week. Exercise boosts blood flow, delivering oxygen and glucose to your brain cells, preventing shrinkage. 3. Nutrient-dense foods. Eat foods like garlic, parsley, radishes, Brussels sprouts, bone broth, turmeric, sauerkraut, beet tops, milk thistle, and cruciferous vegetables. These help dissolve amyloid plaques and protect your brain cells. 4. Load up on DHA-rich foods. Consume foods rich in DHA, such as pasture-raised eggs, shellfish, beef liver, and oily fish like salmon, sardines, and mackerel. DHA helps prevent hippocampus shrinkage, crucial for memory and learning. Taking these steps can supply your brain with the nutrients it needs, potentially reducing the risk of Alzheimer's from an early age. It's never too early or too late to start taking care of your brain. Recognizing the early signs of Alzheimer's can be life-changing, allowing for early intervention and better management of the disease. If you or a loved one are experiencing any of these symptoms, it's crucial to consult with a healthcare professional for a proper diagnosis and personalized advice. We hope you found this information helpful. For more insights into Alzheimer's disease and other health topics, be sure to explore our other videos on the channel. Don't forget to subscribe and hit the bell icon so you never miss an update. Thanks for watching, and until next time, take care of your brain health and stay informed.